I am honored to be here today to introduce Ms. Valerie Jarrett. Valerie Jarrett is the president of the Obama Foundation and a WBA board member. Previously, she served as senior advisor to President Barack Obama and oversaw the offices of public engagement and intergovernmental affairs. She and I today will be discussing inclusive healthcare. Hello, Valerie. How are you today?
I am well. How are you doing, Carlos?
I'm doing wonderful. Good to see you. You know, Valerie, before we get started, I just wanted to kind of jump in here really quick and say I think it was about a year and a half ago, you and I were both in North Carolina, and we were introduced by a mutual friend, Dr. Sheila Robinson, who introduced us at the Diversity Women's Conference. And you and I talked about potentially having you come and speak to our leadership and just bringing some of your insights into WBA. And how excited was I to find out a year later that you had been added to our board of directors. So as we think about that move, talk to me about how you made the decision to join WBA and how you can help us to promote diversity, equity, and inclusion at this organization?
Well, it's a good question. So at this stage of my life, given my background in healthcare, I chaired the board of the University of Chicago Medical Center for a number of years. I worked on the Affordable Care Act when I was a part of the Obama administration. One of the observations and concerns I've always had is the disparity of healthcare across our country. And I have always been a consumer of Walgreens and have had a personal relationship with the pharmacists. And so I've always wondered what would happen if Walgreens migrated more into the healthcare space. And so when I was approached to join the board, that is the conversation I had. And it was made clear to me that the strategic direction we were going in was to see what we could do to better provide those preventive and primary care services that are missing from so much of the citizens of our country. They don't have access to it. So that's what attracted me in the first place. And so right kind of back to you, Carlos, a big piece of what you're doing is focusing on the issue of closing the gap between equity and inclusion. And given our current climate and having been in the midst of this COVID-19 pandemic that has had such a disproportionate impact on particularly communities of color, how do you think about this issue now?
Well, that's a great question. And when I think about all that we're doing here at Walgreens Boots Alliance, we have termed a motto that we want diversity, equity, and inclusion to be at the center of everything we do. So what does that mean? So when we think about our organization as a whole, we want to make sure that our employees, our customers, the community at large are taken in consideration first and foremost before we make any business decision. As a consumer-based organization, we realize that our mere existence depends on customers and patients coming into our stores and utilizing our services and utilizing our pharmacies and the things that we have to offer. So that means that we need to understand the community. We need to reflect the community. We need to give back to the community. So when COVID-19 hit, we set up testing centers across the country, and 70% of our testing centers for COVID-19 were located in underserved areas. And these are underserved areas as defined by the CDC Social Vulnerability Index. So we wanted to make sure that we had access, that we were educating the community, and that we were giving them the information that they needed in order to continue to sustain their lives. The other thing I'd like to throw out is when we look at our internal workforce, we wanted to make sure that our workforce reflected the community where we do business. So we have pretty solid standards within the organization for our leaders to drive diversity, equity, and inclusion across the organization. Last year, we were also faced with this with this racial equity movement. And throughout that time, many corporations were struggling to put policies and practices in place to deal with that. Well, I'm happy to say that at Walgreens Boots Alliance, we were already down the road with our policies, our procedures, and some of the work around equity and inclusion. And some of that work led to us diversifying our board and luckily bringing you on board and promoting goals and metrics within our organization to really diversify the team. So many different things. I could go on forever, but I'm going to stop there. I mean, there are a number of things that we're doing to drive diversity, equity, and inclusion, not only internally, but externally into the communities. So what I want to come back to you with is Dr. King said many years ago, of all the forms of inequality, Injustice in healthcare is the most shocking and inhumane. So talk about how systemic racism has had an impact on health disparities, and what can we do to overcome those challenges, Valerie?
Well, you're absolutely right. And I think I've been aware of these disparities. It's one of the reasons the Affordable Care Act had resources in there to study the health disparities so that we could try to close them. Part of it is just the access to quality, affordable health care. The Affordable Care Act was intended to make health insurance more available, more affordable, and in fact has done so. But another piece of it that's been exposed from the COVID-19 is the fact that people aren't getting the same quality, and as a result, their health outcomes have been a lot worse. Chronic illnesses that we know are a contributing factor. And so figuring out ways of closing those disparities becomes more acute in the midst of our current pandemic. And so I would really love for you to talk about how are we going to use our strategies to reach people who might be hesitant to take the vaccine, for example, Carlos, because those are the very people who probably have comorbidities that could contribute to worse outcomes should they contract it. So what is Walgreens doing to make sure that we're reaching that population and making it available to them, but also to help talk them into taking the vaccine because the data shows that they're reluctant to do so?
Right. Well, so a number of things that we're doing as an organization. So the first thing is we want to educate the community and try to regain trust. And we know that regaining trust, there's a number of things that we have to overcome. One is getting the right message out. And the way we get the right message out is to make sure we have the right messenger, making sure that we're utilizing people that can interact and that could connect with those communities to really bring the messaging forth that's going to put them at ease. You know, we looked at a study, I think with the Pew Research about a couple months ago that said that 60% of Americans said they're not taking the vaccine. And of that 60%, 58% of African Americans stated they were not going to take the vaccine. So there have been other issues in our past, in our history, like the Tuskegee experiment, that have caused distrust. So what we need to do is to make sure that we're giving the right information, that we're putting out the right education, and we're connecting in the communities and meeting these folks where they are so that they understand that the vaccine is safe and that if we're going to get our life back to normal in this country and across the globe, the vaccine is important.
That's why I joined the Walgreens board.
And we're glad to have you here. So Valerie, I know that we're getting low on time. I would really like to thank you for your time today. Thank you for your insights. And I'm really looking forward to you working to help advance diversity, equity, and inclusion within our organization. Thank you for your time.
Thank you, Carlos.